Should pediatricians refuse to treat patients who don't vaccinate? Parents who don't want to vaccinate their children are a perennial sore subject in my profession. The question bubbled up again this spring at the American Academy of Pediatrics Annual Leadership Forum, where Academy leaders vote on issues of concern to pediatricians across the country. Two of the top 3 resolutions this year were about vaccine refusal. One requested a policy statement calling for the elimination of non-medical exemptions to the requirement that children be immunized to attend school and daycare. The other asked the Academy to support pediatricians who decide to discharge patients after a reasonable, finite amount of time working with parents who refuse to immunize their children according to the recommended schedule, or who fail to abide by an agreed-upon, recommended catch-up schedule. Let me tell you about 2 cases of pertussis, whooping cough, from about 15 years ago. The first one is my own, probably caught from a sick kid, back before the development of the adult booster shot. Thanks to an astute colleague, I got the diagnosis, and we began the wearisome task of contacting the families of every child I had seen in the clinic or the newborn nursery during my infectious days to inform them of the possible exposure. I didn't give it to him, but the second case was a preschool-age patient of mine whose mother had refused vaccination, insisting that she wanted to wait on the vaccine that protects against pertussis. It wasn't a terribly dangerous case of whooping cough. The patient's airway wasn't compromised, the way infants' airways often are, but he was pretty sick and pretty miserable for a good long time. As was I. We treat pertussis with antibiotics, which make the sick person non-infectious, but the cough, which is severe enough to cause rib fractures in some unfortunate patients, can persist for 6 weeks or more.